What is the aim of this? What are you going to do in these 21 days? People are confined. Why we are confined? And during this time, what is going to happen outside our house? The aim or goal of this lockdown and quarantine, etc. Number one is to know the real depth of this problem. If you are going on moving, spreading, then the depth will be increasing. Now confine yourself. The government will know what is the real depth of this problem. How? Do more and more tests. Screen all the suspects. Do a diagnostic test for all the suspects. Who are these suspects? After all, this has come from another country. So, who have travel history, who have contact history with a known patient, they are all the suspects. So all these suspects have to go through a diagnostic test to know whether they have the problem. That is one. From that you will know the depth of the problem. How many people, how many persons are affected by this. Second, by isolating the people who are having this, treating these people, you can prevent the spread from these people who have come all the way from other countries, who have a travel history. In other words, we call it imported cases. The cases are imported. It doesn't belong to our country. They have got it from some other country and have brought it here. All these cases, proven cases, who are diagnosed with this will be confined, and the cases are isolated. People are confined, so you are not exposed to unknown asymptomatic patients. There may be some people who may not show symptoms, but they'll be carrying these organisms. One. Second thing, unknown cases. You don't know. You are going in a gathering. You meet a lot of people. You talk with a lot of people. You don't know how many people are suffering there. So from those people you may get. So it will be very difficult to trace from whom you got. So for that you are asked to confine yourself in your house. Remember, all these are done for one purpose, that is to prevent our country, which is in stage 2, to prevent going to stage 3, what we call community spread. Now we'll see what is this community spread. During our lockdown, what do the government do? Number one, the first thing is surveillance. Initially what they do is a passive surveillance. Passive surveillance means they will test people who come to the hospital with some symptoms and signs. Do test for those people. That means the doctors, the paramedics will be there in the hospital. People will go to the hospital with complaints and they will be checked. This is called passive surveillance. After that, the cases are isolated. Once the cases are isolated, the contacts are traced. Third, the families of these cases are quarantined. The borders are sealed so that no interstate or inter-district crossing over. The flights are cancelled. No import or export of cases. So at the end of first week, the number of cases may increase due to the tests that we are doing. More and more tests are being done. So at that time, the cases may go up, but it is not spreading. Now only we have started doing tests. That is why the number of cases gets increased during this period. Now, what does the stages mean? This is for any infectious, communicable or contagious disease. There are 4 stages. Stage 1, what we call it as imported cases. When all the confirmed cases have a travel history, going to an affected country and coming back from that country contracting the disease. So they are importing the disease. So they are called imported cases, stage 1. What is second stage? In this second stage, in the first stage, we talked about imported cases, cases from people who traveled abroad where the disease is there and they got the disease there and they come back to our country and they have imported the disease. So they are called imported cases, stage 1. After coming to our country, these people will move with many people and some of them may get the disease. Now, when we see a positive case, we'll immediately ask from where you got this disease. He will immediately say, I have a relative who went abroad, he came back, so we had a party and after that only he got it. Now, you know the contact from whom this person got the problem. Now, next thing is we will ask how many people are attended the party and we will all test this. Now, this stage is second stage. Why? Because it is second stage. When a person comes with a problem, we are able to trace the contact. We are able to trace that traveler who brought this disease to our country. Then after that, we will search who are all the people got the disease from that person. So this is called contact tracing. So this is possible in stage 2. But remember, in the stage 3, when you get a disease, when you get a problem, you cannot trace where they got this problem. This is the difference. Next is stage 3. Stage 3 means a community transmission. When the source of transmission cannot be traced, remember, you get a case, you ask from whom you got this, the person says, I don't know. So this is stage 3. That means a person transmitting people whom he come with contact is different, but he goes out, he mingles with a lot of people and gives to many people, and all those many people do not know from whom they got. This is called community transmission. The importance of community transmission is you cannot trace the case from whom these people got. So if you don't get the source of infection, then very difficult to control. Apart from this one person may give lot of people at the same time. So what really happens in one particular number of cases suddenly increases, an outbreak comes, and they may go for what is that called next stage, what is called the epidemic stage. Disease takes a form, you call it epidemic. That means a sudden outbreak of number of people in a short period that shows you don't have any control over this disease. And the disease goes on spreading. There is no end for this. So our concern is only we should not enter into third stage community transmission, which may lead to an epidemic and an outburst. We are in stage 2. What is it? We know the details of the patient, his history. That means a travel history one, or whether he had contacts with people who are having this. For example, his relatives, a known patient he might have treated, or it may be a doctor or a paramedical who have been treating these people. So contact history and travel history, this we know. And we know the mode of his travel, with whom he moved, with whom he lives. All this we can easily get. And now we can check all these contacts, and all the people are checked for or tested for this, and we call this group of people as suspects. Now we have a clear idea who are all the people to be quarantined. But remember, it's a very big task. Now we will come to the important part, what we are going on now. We are experiencing the lockdown. Now we'll see the concept of lockdown. I told it is based on incubation period. What is incubation period? An organism enters into your body. You don't know that it has entered. Just think. After some time, you will get fever, cough, something like that. That means that are the symptoms. So incubation period is nothing but the interval or the duration between the entry of the organism into your body when you are exposed to that organism and the appearance of the symptom of that particular disease. For example, on April 1, the organism enters into your body. On April 5th, you develop fever, cough, or something like that. These are all the symptoms. So, entry of the organism, April 1, experiencing the symptom, April 5. This 5-day is called incubation period. After all, incubation is nothing but multiplication of the organism inside your body. Once a particular number of organism is reached, when the organism has multiplied to a particular, the body is fighting against that. The symptoms are nothing but the evidence the body is fighting. So this period, this simple period, 5 days, I gave an example, is incubation period. Now the thing is, what is the incubation period for coronavirus? It is not a constant incubation period because this period depends upon the type of the organism, the capacity, the virulence of the organism, state of this person, the host who is receiving the organism, the number of organism, how much it enters into your body, the portal of entry, the age of the person. All this will decide how many days it will take to show the first symptom. So that means, as far as this is concerned, this may be 5 days or it may be up to even 20-25 days. But on an average, the incubation period is 14 days. Okay, right. The question is, okay, fine. So, is it not enough to have a lockdown for 14 days because you said the incubation period is only 14 days? A logic question. But remember, you see this slide. You see, on March 25th, the lockdown is announced and up to April 14. Okay, right. So you have 3 weeks. You see number 1 case, number 2 case, number 3 case in this slide. Number 1 case, he is suffering and he is in the pre-lockdown period. He will come into lockdown period, number 1. For this person, the incubation period is, it starts even before the lockdown. So for example, if this person had this problem on 20th of March, then after that 14 days, he will show that. I have shown number 1, the signs and symptoms in between this second week he will get. If you take the second person, he is getting the problem on March 25th. For him, the incubation period is 2 weeks, of course, 14 days. On April 8th, he will show signs and symptoms. But remember, there's a third person who is there during the first week of incubation period. I mean, the lockout period. This fellow is getting that. So this person will have the signs and symptoms during the 3rd week of this. So number 1. So you have 3 people, 3 sets of people, 1, 2, 3. 1 is covered in this incubation period 14 days. Second is also covered during this incubation period 14 days. For those people, lockdown for 14 days is enough. The third person who is exposed during incubation period or during the lockdown period, then the 3rd week is given for these people. So we want to give another extra week so that those people during the confinement because of the contacts they may have in their house. If these people are exposed during the lockdown period, we will extend one more week, so we will also cover the third person or the third set of people who are getting this problem. This is the logic behind a 21-day. Now you can see here the lockdown starts March 25th. The lockdown ends April 14th. During the first and second week of lockdown, these 14 days, usually you will get more cases. We cannot say that the disease is spreading a lot. It may not be the case, but what really happens during this period, people start thinking about this disease. They start worrying, and awareness has come. One. Second thing, if they have been exposed, now these people will start showing symptoms, and even these small symptoms will make them worry. They will immediately go for testing. So during this period, more and more tests are done. And apart from that, the government also makes it more and more testing places, increase the number of equipments and the testing centers. They purchase more equipments, they employ more people, they employ even new methods for diagnosis of these things. So automatically what really happens, more people are tested, then more and more cases will be there. So there's nothing to worry. But remember, if you follow the instructions given by the government during this period, inside your house, don't expose yourself, cooperate with the government, get tested, follow the advice, avoid exposures, avoid going to places, hygiene measures, hand washing, all this if you follow, if you cooperate during the lockdown, during the third week or at least at the end of the third week, I have shown a curve which has been sharply rising to this first 2 weeks. The third or the end of the third week, you will have the flattening of the curve. That flattening means you have controlled the spread. You have broken the transmitting media. You have followed the rules and regulations and the advices and the guidance given by the government during these 2 weeks, and the result of this a reserved way of living has given this result. Now, is it not a progress towards control? After that, try to eliminate in the meantime, people will develop new drugs, they may develop vaccines. So what our duty during this time is follow the advices, guidance, so that the spread is curtailed and controlled, and you give time for the other government people to find out new ways, new medicines and vaccines, so that we can permanently get away from this problem. Now, the next question somebody will ask, what will happen after 21 days when the lockdown is lifted? See here, what you should do, what you have been doing under pressure, by order, now do it voluntarily, not by this 144. After all, here, the 21-day psychology may work. That means you have been trained, you have been following certain habits like hygiene for the past 21 days. That should continue. So try to continue the same lifestyle that you are having now. Next, avoid unnecessary travel. Avoid gathering as you do now. Avoid entertainment places. Follow the same hand hygiene. Wear masks. Follow the social distancing as you do now. Cooperate with the healthcare workers to identify the cases. This is what you can do after the lockdown is over. Now, after lifting this 21-day lockdown, what the government will do? The aim of that government is, with the cooperation from you have flattened the curve, and they'll try to maintain that, or they'll try to bring down and down. And what do? They hunt for cases now. This is called again surveillance, but this surveillance is called active surveillance. What we had to start with was a passive surveillance. Now it is and active surveillance. What is active surveillance? Very simple. To start with, people who have these symptoms, they went to the doctors and paramedicals. Now, the paramedicals and doctors will come to your house, door to door, checking. They are actively doing a job. They are actively doing a surveillance. They come to your house to know any sporadic cases still there so that they can be treated, they can be isolated. This is called active surveillance. Next, they will try to use other methods of diagnostic methods which are cheaper, which are easier, which will give a result in few minutes, and they will have a test like a rapid diagnostic test will be there. They may bring to your house, they may test and they may find. So the purpose is finding out sporadic cases and treat them, isolate them, so they will not spread to others. In the meantime, they'll try to use vaccines if one is developed. Sure, they will develop. In a matter of 4 or 5 months, it is going on. They're all doing night and day. They are working to find out a vaccine. In fact, usually the vaccine, it may take 1 year. Now, within 3 to 4 months, actually. Next, they will try to use medicine which are available, or they may try to find a new medicine for this. And this is a trial, and they'll give medicines to see whether it is working, other antiviral measures, antiviral medicines, and they will see whether those medicines are working. And it is a trial. And apart from that, they'll do active health education. This health education is very important because community participation, the people's participation is very important, a part of health education. Any program, any measures taken by the government is a failure if the people do not take part in that. So health education is very important as far as this is concerned. Finally, in spite of all these things, there may be some people who will be asking, will it work? These people will oppose for anything. I said many times, it's a matter of trial. It's a matter of cooperation. It's a matter of orders, guidance, ideas from many people. It's not you and I suffering. The whole world is suffering. But for those people who question all these measures, my request is simple. Kindly give us a reasonable, acceptable, proven solution for this. We are ready to follow you. Thank you.